Hey guys, this is Kevin Wojciechowski, and this is lactase deficiency. So what does it mean to be lactose intolerant? Well, lactase is a brush border enzyme on the luminal side of the small intestine, shown here, which hydrolyzes or splits the disaccharide lactose into its constituents, which are glucose and galactose. These can then be brought into an enterocyte. A deficiency in this enzyme can either be primary or secondary. A primary deficiency is due to aging and losing expression of the lactase allele, usually seen in people of Asian, African, or Native American descent. Lactase deficiency can also be secondary, which is usually transient following a bout of gastroenteritis or from an autoimmune disease. Why would gastroenteritis cause lactase deficiency? Well, it can do so by damaging the luminal membrane of the intestinal brush border, which is where lactase resides. Lactase deficiency can also be congenital, but this is usually rare. How does a lactase deficiency typically present? Well, symptoms of lactase deficiency and subsequent lactose intolerance include bloating, cramps, and osmotic diarrhea. You'll see these symptoms because lactose will not be absorbed into the cell and therefore will pull water into the lumen of the GI tract due to the osmotic gradient being created. Bacteria in the gut can then use lactose to form methane, leading to flatulence. You can diagnose lactase deficiency clinically, but stool testing will demonstrate a decreased pH. Let's say you're attending orders an intestinal biopsy to determine the cause of the patient's severe diarrhea or cramps. What will the biopsy most likely show? Well, hopefully you're thinking the biopsy results will be normal. Otherwise, you're wishing your patient ill will. Rude. Remember that lactase is a brush border enzyme. If it's deficient, there will be lack of enzymatic activity on the brush border, but the GI epithelium will still look normal under a microscope. That's assuming that this is a primary defect. Of course, if the intolerance is secondary, there may well be damage in cases of gastroenteritis or autoimmune diseases. However, in the case of primary lactose intolerance, again, this biopsy will appear normal. Treatment for lactase deficiency includes avoiding lactose in the diet or taking lactase pills with food. What food products typically cause problems in those with lactase deficiency? Lactose is typically found in milk and milk products such as cheese and yogurts.